While Dr. Michael West was Winnipeg born and raised, his training in neurosurgery took him from San Francisco to London, Ontario, to Chicago and Cleveland before being recruited back to the Health Sciences Centre in Winnipeg in 2000. The first thing you notice upon meeting Dr. West is how kind and caring he is, disarmingly polite and reserved. You'd hardly expect this from a world-renowned neurosurgeon responsible for authoring or co-authoring over 100 scientific publications and saving literally thousands of lives.
Now, were you really just great in sciences all the way through school?
No, I was pretty good, but I had to work hard at it. I was the eldest in the family and the first one to go to university, actually, but had lots of encouragement from my parents, mainly my mother, who said, okay, well, you can do it if you try hard.
Medical students have many decisions to make about area of study that draws them. For Dr. West, it was the brain that was the most fascinating.
When I was in medical school, I really enjoyed anatomy and particularly neurology. And, it's just a fascinating structure, the brain, the spinal cord, the peripheral nerves. Everything is so organized that it's like an electrical mapping. You can decide this particular area of the brain controls that particular function. And it's all predictable. And it's fascinating to see a patient and work out a problem. I worked with Dr. Dwight Parkinson, who was a world-famous neurosurgeon at the time. And the residents on the service at the time were really sharp people, and they were just all so enthusiastic about what they did. This is for me. I think we see that even today with interns and residents. They watch somebody who's dying before their eyes, and they're operated on and recover. Not everybody does, of course, but it's pretty dramatic.
Over his many years as a neurosurgeon, Dr. West has seen dramatic breakthroughs in both diagnosis and treatment of brain injury and disease.
When I worked with Dr. Parkinson, when we had a patient with neurological symptoms or signs, the ways we could investigate them for a diagnosis of a surgical problem like a tumor or an aneurysm were quite limited. Then in the 70s, it was just revolutionized when Hounsfield in England developed the CT scanner, computed tomography.
In 2003, Dr. West established the first gamma knife in Canada, in which multiple beams of radiation are aimed at areas in the brain. The gamma knife is integrated with today's technologically advanced computers to dramatically shorten the time required for a range of simple to more complex surgeries. This morning, Dr. West is performing a more traditional surgery on an elderly patient with a tumor in her brain.
So, generally speaking, a lesion that's bigger than 3 centimeters is too big for the gamma knife. And also, if that lesion is pressing on the brain and causing paralysis or some problem, the gamma knife doesn't work fast enough to treat the tumor. You have to really excise it to take the pressure off the brain and allow the brain to recover its function.
Some surgeries will require a combination of both traditional and gamma knife surgical techniques.
It's really revolutionary because in some of these benign tumors where we used to spend sometimes as long as 12 or 16 hours in the operating room taking them out, the most delicate nerves are the ones you come to at the very end of the operation when you've been there for a long time and you're really not at your best. So to take out most of the tumor and then leave some for the gamma knife became a really good option.
The surgery today took place in the Center for Surgical Innovation, part of the Clayson Institute for Advanced Medicine at the Health Sciences Centre. In addition to the gamma knife capability, one of only 3 such facilities in Canada, the centre boasts a unique intraoperative MRI scanner which is shared by 2 different operating rooms, moving from one to the other on a track. This design is one of less than 10 in the world. Dr. West and the world-class team of neurosurgeons at Winnipeg's Health Sciences Centre perform over 1,700 neurosurgeries every year, providing life and hope for the future for their patients.